of inflammation, tissue destruction, and attempts at healing are proceeding simultaneously. Chronic inflammation may follow acute inflammation or begin insidiously as a low-grade, smoldering, often asymptomatic response. Chronic inflammation arises under the following settings. The first, persistent infections by certain organisms, such as tubercle bacilli, Treponema pallidum, certain fungi, etc. These organisms are a low toxicity and evoke an immune reaction called delayed hypersensitivity, type 4 hypersensitivity, cell-mediated type. Prolonged exposure to potentially toxic agents, either exogenous or endogenous. Immune reactions are set up against the individually own tissue, leading to autoimmune diseases such as rheumatoid arthritis and lupus erythematosus. Chronic inflammation is characterized by the following morphological features. Number one, infiltration with mononuclear cells, which include macrophages, lymphocytes, and plasma cells, a reflection of a persistent reaction to injury. Number two feature, tissue destruction induced by the inflammatory cells, secondary necrosis. Number three, attempts at repair by connective tissue replacement. And number four, proliferation of small blood vessels and fibrosis. Classification of chronic inflammation may be productive and exudative. Classification of chronic proliferative inflammation. Proliferative, interstitial, number one, number two, granulomatosis, and number three, proliferative inflammation with papilloma or condyloma or polyps formation. Interstitial proliferative inflammation is the variant of proliferative inflammation in the stroma of organs, myocardium, interstitial myocarditis, lungs, pneumonitis, kidneys, interstitial nephritis. Interstitial proliferative inflammation is the accumulation of inflammatory cells in the stroma, and the outcome of interstitial proliferative inflammation is interstitial sclerosis. Now, slight interstitial myocarditis, page number 79, picture number 51. Picture number 51. Number one in the scheme, number one, inflammatory infiltrate. Number one, inflammatory infiltrate. 1A, what is infiltrate? A, macrophage. Macrophage. 1A, macrophage. B, plasma cell. B, plasma cell. This is plasma cell. C, lymphocyte. This is small cell. Is lymphocyte. 1D, eosinophil. 1D, leukocyte eosinophil. This is 1D, eosinophil. And 1E, monocyte. 1E, monocyte. This is monocyte. Monocyte is smaller than macrophage. Number two, dystrophic changes of cardiomyocyte. Dystrophic changes of cardiomyocyte. Dystrophic. And number three, necrosis of myocyte. This is necrosis of cardiomyocyte. This necrosis of cardiomyocyte. In the slide, we can see infiltrate between fibers of cardiomyocyte. This is cardiomyocyte, and this cardiomyocyte between these fibers we can see this infiltrate consists of macrophage, plasma cells, lymphocytes, eosinophils, and monocytes, all types of cells. Okay, next. Electron micrograph activated macrophage. Macrophage has a bean-shaped nucleus and abundant cytoplasm. The cytoplasm contains small primary lysosomes and dark secondary lysosomes. Numerous absorptive and phagocytic vacuoles can also be seen. This is macrophage, and we can see lysosomes. This is lysosomes, phagocytic lysosomes. Next, Langerhans type germ cells. Granular inflammation is a specific type of productive reaction characterized by accumulation of modified macrophages and epithelioid cells and initiated by a variety of infection and non-infection agents. A granuloma is a focal area of granulomatous inflammation. Granuloma is a morphological unit of granulomatous inflammation of chronic proliferative inflammation. There are two pathogenetic types of granulomas. First type, foreign body granulomas, and immune granulomas. Immune granulomas. Two factors determine the formation of immune granulomas: the presence of particles of organisms, etc., the tubercle bacillus, and T-cell-mediated immunity to the inciting agents. Products of activated T lymphocytes, principally interferon G, are important is transforming macrophages into epithelioid cells and multinucleated germ cells. Epithelioid cells have a pale pink granular cytoplasm with indistinct cell boundaries, often appearing to merge into one another. The nucleus is less dense than that of a lymphocyte, is oval or elongated, and may show folding of the nuclear membrane. Germ cells may attain diameters of 40 to 50 millimeters. They comprise a large mass of cytoplasm containing 20 or more small nuclei arranged either peripherally, is a Langerhans type germ cell, or central, is foreign body type germ cell. They form as a result of integration of epithelioid cells. Okay, however, macrophages transformate in the epithelioid cells. Epithelioid cells transformate in the germ cell. There are two types of germ cell. Langerhans type, this is immune type. This is immune type, and Langerhans type has nuclei in the periphery of the cell. Peripherally. Foreign body type germ cell is non-immune granulomas, and the cell has a nuclei in the central of the cell. Okay, in the electron micrograph Langerhans type germ cell, the cell comprises a large mass of cytoplasm containing 20 or more small nuclei arranged peripherally. This is cell, one cell, and we can see numerous nuclei, one nuclei, two, three nuclei, the boundaries, yes, and numerous nuclei in the peripherally. It's important, peripherally in the Langerhans type germ cell. Next, tuberculosis of the lungs. This is tissue of the lungs, and we can see fossa, number, numerous, multiple, numerous. This is numerous foci. This is foci, shape around, size 1 to 2 millimeters. Small, very small foci, 1 to 2 millimeters. Color white. This is foci, white color, and consistence firm. This is small foci, white color, around shape, 1 to 2 millimeters in the size. Adjacent lung tissue, emphydematous. Next, microscopically measuring tuberculosis of the lung. This is in the scheme. We can see one granulome, one morphological unit of the granulomatous inflammation. Number one, in the central of the granulomes, near the center, caseous necrosis is the type of the coagulative necrosis. This is caseous necrosis in the central of granulome. Peripherally from necrosis, number two, epithelioid cells. Elongated cells is the epithelioid cells, number two. Number three, this is epithelioid cells around in the central necrosis. Number three, this is lymphocytes. Numerous lymphocytes. And number four, this is multinucleated Langhans type giant cells. And lymphocytes around in the periphery. This is giant cells. And you can see these nuclei arranged in the periphery of the cells. That is giant cell Langhans type immune granulome. Okay, in the microscopically histologically prepared site, this is granulome, and one granulome in the granulome. This is foci. Focus is the one granulome. This is one granulome in the central necrosis, caseous necrosis, peripherally from the necrosis, epithelioid cells and giant cells, Langhans type, in the violet color, peripherally is the nuclei, violet color, and we can see numerous lymphocytes around this granulome. Necrosis, epithelioid cells, giant cells, Langhans type in the immune granulomes, and lymphocytes. Okay, next. Sarcoid granulomas of the liver. Sarcoidosis. Granuloma. This is in the scheme one granulome, and this granulome without necrosis. We can see necrosis in this granulome without necrosis. And number one. This is picture number 53, page number 85 in the workbook. Number one, epithelioid cells. This is elongated cells, epithelioid cells in the central of this granulome. Number two, multinucleated Langhans cells. This is cells, multinucleated Langhans cells. The nuclei arranged to the periphery of the cell. Number three in these sarcoid granulomas, lymphocytes. And number four, fibroblast. This is elongated. cell is the fibroblast. This fibroblast may make the capsule around granule. In the slide, without necrosis. Compare if you can compare to the tuberculosis granulomes. In these granulomes, we can see necrosis. This is granulomes without necrosis. In the center, we can see elongated epithelioid cells. This is cells, giant cells, Langhans type cells, immune granula, Langhans type cells, and violet color peripherally nuclei, and lymphocytes peripherally of the granulomes, and elongated fibroblasts, and fibroblasts make the capsule of granulomes. This is sarcoid without necrosis. Gumma in the liver. This is granulome. In this granulome, number one, casus necrosis. In this granulome, we can see necrosis. Two, same like in the tuberculosis granules. It's necrosis, casus necrosis. Number two, plasma cells. This is plasma cells. If you compare to the tuberculosis granulomes in this gumma, we can see plasma cells. Okay, number three, lymphocytes. This is lymphocytes. With the big nuclei, lymphocytes. Number four, macrophages, big cells, macrophages. Number five, fibroblasts. This is fibroblast. And number four, productive vasculitis. Number six, productive vasculitis. This is important features of the gumma in the liver. Productive vasculitis. This is immune granulomes. This is syphilis, and caused by Treponema pallidum, syphilis. Features of this granulome are plasma cells, fibroblasts, macrophages, and productive vasculitis. We can see Langhans type giant cell, and we can see epithelioid cells. This is done. Okay, next, aorta in cardiovascular syphilis. Gross, diameter enlarge, shape silk-like, intima butt of tree, figurative name tree bark, syphilitic arthritis. A, intima, B, media and adventitial, In media and in the adventitial, we write 1, 2, 3, 4. This is infiltrate. Number one, plasma cells. This is plasma cells. This is plasma cells. Number two, vasculitis in vasovasorum. This is vessels, blood vessels. And vasculitis, number two, vasculitis. Number three, fibroblasts. This is elongated cells, fibroblasts. And number 4, lymphocyte small cells is lymphocyte. Small cell is lymphocyte. Okay, next, syphilitic arthritis. Staining Wegert's results in A. Intima. B. Media and adventitia. A1. Unaffected elastic fibers. Unaffected elastic fibers. This is normal elastic fibers. This is lysis elastic fibers. In these lysis elastic fibers. Absence normal elastic fibers. Skin in lepromatous leprosy. Lepromatous. Lepra is a granulomatous disease. And in the microscopically, we can see Virchow cells. Okay. Number 1, granuloma in leprosy. Granuloma in lepra. This is lepra's granuloma. A. Lymphocyte. This is numerous lymphocyte. B. Macrophage in white cytoplasm. B. In the central granuloma. Macrophage in white cytoplasm is the Virchow's cell. Number 2, sclerosis of stroma. This is sclerosis of stroma. Case number 28. You read this case, please. And question: what are the most likely cause and pathogenesis of sarcoidosis? Unknown cause, and morphological unit of sarcoidosis is sarcoid granulomes. Number 2, describe the histological appearance of the skin. I remind you this slide. These are sarcoid granulomes. This is sarcoid granulomes, maybe all organs, lungs, liver, myocardium, bones, maybe spleen, This is granulomes, sarcoid granulomes. We can see epithelioid cells, germ cells, lymphocytes, and fibroblasts. Question number 3. What type of inflammation developed in the skin? This is chronic proliferative granulomatosis inflammation. I remind you classification of chronic inflammation. Chronic inflammation divided 2 types, productive or proliferation and exudative. Classification of chronic proliferative inflammation is interstitial or granulomatosis. And third type with petalons, candylomes, and polyps. Main 2 type of classification of chronic proliferative inflammation, interstitial and granulomatous. This is chronic proliferation granulomatous inflammation. Question number 4. What other manifestations may be seen in this condition? This is systemic disease and systemic process. Question number 5. Differentiated the sarcoid and tuberculous granulomes microscopically. Main feature on compare sarcoid granulomes and tuberculosis granulomes is necrosis. To the sarcoid granulomes, necrosis absent. No necrosis in the sarcoid granulomes. In the tuberculosis, in the central granulomes, we can see necrosis. We can see necrosis in the tuberculosis, necrosis in central of granuloma, in the sarcoid, without necrosis. Sarcoid granulomas is without necrosis. Okay. Next case, 29. 29. Case, patient with thoracic aorta aneurysm. Question number 1. Describe the microscopic appearance of aorta in this patient. Tree back appearance, insufficiency aortic valve. Question number 2. Describe the histological abnormalities in syphilitic aortitis. This is granulomatous infiltrate in media. I remind you this microscopically. Syphilitic aortitis, intima and media, in the media infiltrate, productive vasculitis, and cell plasma, cell lymphocyte, and fibroblast. Question number 3. What variant and what stage of the syphilis did this patient develop? This is acquired syphilis, and this is tertiary syphilis. Question number 4. What other organs can be involved at this stage on the disease? Maybe all organs. Main heart, lung, brain, liver, bone, and nose, cartilages, nose. This is main organs in the tertiary syphilis. And question number 5. Differentiate syphilitic and tuberculosis granulomas microscopically. Back, syphilitic, syphiloma, in the liver, and tuberculosis, small granuloma. You remember 1 to 2 centimeters, small granuloma, 1 to no centimeters, millimeters, millimeters, 1 to 2 millimeters. In the tuberculosis, size 1 to 2 millimeters. I'm sorry, this is a mistake. 1 to 2 millimeters. Very small. And in the tuberculosis, we can see epithelioid cell. In the syphilis, granulomas without epithelioid cells, but with plasma cell and fibroblast. This is 3 type granulomas in the syphilis, in the tuberculosis, and in the sarcoidosis. I remind you now, in the tuberculosis, necrosis, caseous necrosis, epithelioid cell, giant cell, and lymphocytes. 3 type of cell: epithelioid, giant cell, and lymphocytes. Sarcoid granulomas, without necrosis, but of this type cells: epithelioid, giant, lymphocytes, and fibroblast, but without necrosis. Please remember it. In the syphilis, necrosis, but don't giant cell, without epithelioid cell, but with plasma cell, fibroblast, and vasculitis. Vasculitis is main feature of granulomas of syphilis. Okay. Last case. You read, please. And question number 1. What are the histological findings in the lungs of the patient? This is caseous necrosis. This is tuberculosis. Tuberculosis. I explained you now about histological findings in the tuberculosis. Question number 2. What is the pathogenesis of tuberculosis granuloma? This is immune pathogenesis. This is immune pathogenesis, and type 4, hypersensitivity, T cell mediated. Question number 3. What cell transformations can be found in tuberculosis granulomas? Main cell in tuberculosis granulomas is monocyte. Monocyte transformates in macrophage. Macrophage transformates in epithelioid cells. Epithelioid cell transformates in giant cell, Langhans type giant cell. Monocyte, macrophage, epithelioid cell, Langhans cell, giant cell. Okay, number 4. Question number 4. What are the causes of caseous necrosis in tuberculous granuloma? Necrosis in the tuberculous granuloma is outcome of lysis of macrophage. And question number 5. Differentiate tuberculosis and leprosis granuloma microscopically. Tuberculosis granuloma. I remind you, leprosis. This is lepra. Without necrosis, without epithelioid cells, but with Virchow's cells. In the lepra, Virchow's cells. This is macrophage in light cytoplasm. Okay, I remind you now else. Tuberculosis granulomas. Now this tuberculosis granulomas. This is one granulomas. In the central, caseous necrosis is outcome of lysis of macrophage. Peripherally from necrosis, epithelioid cells. And in the miliary tuberculosis, in the tuberculosis granuloma, we can see giant Langhans type giant cells. And in these cells, nuclei arrange peripherally in this cell. And around granulomas, lymphocytes. This is tuberculosis granulomas. Please remember it. Sarcoid granulomas. This is granulomas without necrosis. In the center, we can see epithelioid cells, giant cells, Langhans tip, and lymphocytes in the peripheral granuloma. Around this granuloma, fibroblasts. In the syphilis granuloma, syphilitic granuloma, caseous necrosis, plasma cells, macrophages, fibroblasts, lymphocytes, and main feature of syphilitic granulomas is productive vasculitis. And leprous granulomas without necrosis, without necrosis, without epithelioid cells, without Langhans type gene cells, but with Virchow cells, in the lighter cytoplasm, and lymphocyte, Okay, I end the explaining, and I wait from every student workbook and result of your test. Now and today, tomorrow, and all days of week. Okay, bye bye.